But first, here's Brenda with our special guest.
All right, thank you so much, Gary. Did you know that a woman's weight gain can be attributed to hormones? Some other factors include poor nutrition, adrenal fatigue, and thyroid. So what can women do to get back on track? Dr. Stephen Hotze from the Hotze Health and Wellness Center is here with some answers, and I'm just tongue-tied this morning, aren't I? Good morning to you.
Good morning to you, Brenda.
Let's talk about the role that hormones play in a woman's weight gain or loss.
Well, very common. Women will notice sometime in midlife, maybe after they've had a child, maybe even after they start on birth control pills, that they notice a significant gain in their weight. And that's usually an underlying sign that they have a hormonal imbalance or a hormonal decline. Very commonly, it comes from the female hormones as they begin to become imbalanced as a woman matures and goes through her life, which adversely affects the hormone from the thyroid gland, the thyroid hormone, which governs our metabolism. So if the thyroid gland makes less thyroid hormone, or the body is less able to assimilate the thyroid hormones, a woman's metabolism will go down, and guess what happened? Her weight goes up. And she may not have changed her diet at all, and she may still be exercising the same amount. We hear this all the time. I exercise and I eat right, but my weight won't go down. Well, that's a sign often that she does not have enough thyroid hormone within the cells of her body. Now, she may also have you can have the right amount of thyroid, but if you're not eating right, if you're on a high carbohydrate diet with a lot of fast foods, well, you're not going to lose weight doing that. Exercise, of course, is important, but you've got to have the right hormonal balance. And the hormones that we recommend, rather than using synthetic thyroid hormone, we recommend the use of Armour thyroid, which has been around for 110 years, and we recommend it because it really helps a woman jumpstart her metabolism.
Let's go back a little bit. You talked about women being on the pill. That's so common. You always hear about a woman gaining 5–10 pounds when she's on the pill.
And the reason is that birth control pills are drugs that mimic a woman's hormones. They turn off her hormones, her natural production of female hormones, and the birth control pill has an adverse effect on the thyroid hormone's ability to get assimilated into the cells.
So prolonged use of the pill?
Yeah, it can cause problems with weight gain, and that's plus a host of other problems. Without getting into the whole issue of the birth control, there are other ways that are safer to govern your pregnancy or determine when you're going to get pregnant than taking drugs that mimic your hormones.
Okay. Now, what do we do to correct this imbalance?
Well, I think it's important to find a physician that'll listen to your symptoms. Women that have fatigue, weight gain, hair loss, joint pain, can't sleep well, depressed moods, oftentimes go to the physician. Physician draws their blood, tells them that their blood tests are normal, and then puts them on an antidepressant when they clearly have all the signs of low thyroid. And at the Hotze Health and Wellness Center, what we do is we evaluate a woman clinically what her symptoms are, and if she has therapeutic signs of low thyroid, in our clinical judgment, she deserves a therapeutic trial of some Armour thyroid to see if that helps get her metabolism up.
Help me understand this Armour thyroid.
Armour thyroid is pork thyroid. It's derived from pork gland. Armour thyroid, Armour bacon.
Yeah.
Same. So they take the thyroid gland out, desiccate it, dry it. It's an FDA-approved product, and it's been in use for 110 years in America. But it's very inexpensive, and so the drug companies don't make a lot of money promoting thyroid, but they make a lot of money promoting other things like sleep medication and antidepressants.
Could you feel like you're going down the wrong path at some point because you're getting off of one type of medication to get on another and perhaps another?
Well, oftentimes women, if their underlying problem is not correctly diagnosed, if their hormonal imbalance and decline is not diagnosed correctly, they do get on a host of drugs, which just can have adverse effects and cause more problems. I don't ever want a woman to walk into a doctor and be told her blood test is normal and made to feel like she's a hypochondriac or a neurotic or a hysteric. Problems that women have in midlife are very easily treated, but they usually have one underlying problem, and that's hormonal decline and imbalance. So we use biologically identical hormones, bioidentical hormones, for the female hormones, and we use natural thyroid to get the metabolism up.
How common is a misdiagnosis of the thyroid?
It's extremely undiagnosed because most doctors don't think about it. They just don't think about hormonal problems because they look at a blood test and they're basing it all on a blood test rather than on the clinical history of the patient. And the blood test levels are so wide, they're as wide as the Grand Canyon, as tall as the Empire State Building, that 95% of the people always fall within the normal range. And that gives the doctor then nothing to work with, so he says take an antidepressant, which causes weight gain, which causes more depression,
And you're in this
suicide.
bad cycle, yeah.
You're in this.
What about supplements?
Well, there's some important supplements that a woman could use that she should use in adjunct with hormonal therapy. Chromium picolinate, which is a mineral, which helps with sugar cravings. Alpha lipoic acid, which helps with detoxification of the liver, also helps with lowering insulin levels. Another one is L-carnitine, which cuts fat. So those are 3 supplements a woman could use that can be very beneficial. So a combination of replenishing the hormones with natural occurring hormones, not drug company counterfeits, exercise program, proper high protein, low carbohydrate diet, and some vitamin, minerals, and nutrients can go a long way to helping a woman look well and feel well.
All right, thank you, Dr.
Thank you, Brenda.
Hotze. You know, I want to say Hotze, but I'm not. I didn't say that. For more information about the Hotze Health and Wellness Center, log on to drhotze.com or call 877-698-8698. Gary, Amy, I think I can say Hotze now.
We'll say it. Thank you very much, Dr. Hotze.
Okay.
Thank you, Brenda. Hey, we have a lot more to offer on Good Morning Texas.